Swollen legs aren't just uncomfortable, they're stealing your energy and limiting your life. Leg swelling in seniors is incredibly common, affecting nearly 40% of people over 65. But common doesn't mean normal, and it definitely doesn't mean you have to live with it. 3 vitamins could give you back the mobility you thought was gone forever. Here's what most people don't realize about swollen legs in seniors. Sometimes, the solution isn't found in expensive medications or complicated treatments. Sometimes, it's as simple as 3 specific vitamins that your body desperately needs, but probably isn't getting enough of. Today, we're diving into 3 powerful vitamins that can reduce swelling and improve circulation. Before we jump in, if you're new here, please hit that subscribe button and ring the notification bell. Now, let's dive in. Number 1, vitamin D. Let's start with vitamin D, often called the sunshine vitamin. Most people think of vitamin D only for bone health, but research shows it plays a crucial role in reducing leg swelling and improving circulation. Here's what's happening in your body. When you're deficient in vitamin D, your blood vessels lose their ability to regulate fluid properly. This leads to fluid retention, particularly in your lower extremities. Your legs become the collection point for excess fluid because gravity naturally pulls it downward. Studies have shown that seniors with adequate vitamin D levels have significantly better circulation and less fluid retention. The vitamin helps your blood vessels maintain their elasticity and proper function. It also reduces inflammation in your circulatory system, which is often a hidden cause of chronic swelling. The practical benefits are remarkable. When your vitamin D levels are optimal, you'll likely notice that your legs feel lighter, especially at the end of the day. The puffiness around your ankles may decrease, and you might find that your shoes fit more comfortably throughout the day. So how do you get enough vitamin D? The most natural way is through sunlight exposure. Aim for 15 to 20 minutes of direct sunlight on your skin daily, preferably in the morning or late afternoon. However, many seniors have difficulty absorbing vitamin D from sunlight alone, especially those with darker skin or limited outdoor time. Food sources include fatty fish like salmon and mackerel, egg yolks, and fortified dairy products. However, it's often challenging to get enough vitamin D from food alone. This is where supplementation becomes important. Most healthcare providers recommend 1,000 to 2,000 IU daily for seniors, but you should have your blood levels tested first. A 25-hydroxy vitamin D blood test can determine your current vitamin D status and help your doctor recommend the right dosage. The risks of ignoring vitamin D deficiency go beyond swollen legs. Low levels are linked to increased risk of falls, fractures, and cardiovascular problems. But the good news is that vitamin D deficiency is easily correctable, and you may start noticing improvements in leg comfort within just a few weeks of addressing it. Number 2, vitamin B1. Now let's talk about vitamin B1, also known as thiamine. This might be the most overlooked vitamin when it comes to leg swelling, but it's absolutely critical for healthy circulation and heart function. Thiamine deficiency is surprisingly common in seniors, and here's why it matters for your legs. Vitamin B1 is essential for proper heart function and circulation. When you don't have enough thiamine, your heart struggles to pump blood efficiently throughout your body. This leads to fluid backing up in your legs and feet, causing that uncomfortable swelling you're experiencing. The connection between thiamine and leg swelling is so strong that doctors often look for B1 deficiency when patients present with unexplained edema. Your heart muscle needs thiamine to contract properly and maintain a strong, steady rhythm. Without it, your circulation becomes sluggish, and fluid accumulates in your lower body. What makes this particularly relevant for seniors is that thiamine absorption decreases with age. Additionally, certain medications commonly prescribed to older adults, including diuretics and some diabetes medications, can further deplete your thiamine levels. The practical impact of adequate thiamine is significant. When your B1 levels are optimal, your heart pumps more efficiently, moving fluid through your circulatory system instead of allowing it to pool in your legs. Many people report that their legs feel less heavy and that nighttime leg cramps decrease when they address thiamine deficiency. Rich food sources of thiamine include whole grains, pork, fish, beans, and nuts. However, processing and cooking can destroy much of the thiamine in foods, so many seniors don't get enough from diet alone. A high-quality B-complex supplement is often the most reliable way to ensure adequate thiamine intake. Look for supplements that provide at least 100% of the daily value, which is about 1.2 mg for men and 1.1 mg for women. The consequences of ignoring thiamine deficiency can be serious. Beyond leg swelling, severe deficiency can lead to heart problems, confusion, and difficulty walking. In extreme cases, it can cause a condition called beriberi, which affects both the cardiovascular and nervous systems. Number 3, vitamin C. Our third game-changing vitamin is vitamin C, and its role in reducing leg swelling might surprise you. Most people think of vitamin C only for immune support, but it's absolutely essential for healthy blood vessels and proper circulation. Here's the science behind it. Vitamin C is crucial for collagen production, which is the protein that keeps your blood vessels strong and flexible. When your blood vessels are healthy, they can efficiently move blood and fluids throughout your body, preventing the stagnation that leads to swelling. Additionally, vitamin C is a powerful antioxidant that reduces inflammation in your circulatory system. Chronic inflammation is often an underlying cause of persistent leg swelling. By reducing this inflammation, vitamin C helps your body maintain proper fluid balance. Research has shown that people with adequate vitamin C levels have stronger capillaries and better overall circulation. This translates directly to less fluid retention in the legs and improved comfort throughout the day. The practical benefits extend beyond just reducing swelling. When your vitamin C levels are optimal, you may notice that cuts and bruises heal faster, your skin looks healthier, and you have more energy. These are all signs that your circulatory system is functioning better. Excellent food sources of vitamin C include citrus fruits, berries, bell peppers, broccoli, and leafy greens. The key is to eat these foods fresh, as vitamin C is easily destroyed by heat and storage. This is why many seniors benefit from supplementation, especially during winter months when fresh produce is less available. For leg swelling specifically, aim for at least 500 to 1,000 mg of vitamin C daily. This is higher than the basic recommended amount because therapeutic doses are often needed to see significant improvements in circulation. One important note about vitamin C is that your body can't store it, so you need consistent daily intake. Taking a large dose once a week won't be as effective as smaller amounts taken regularly. The risks of vitamin C deficiency include not just leg swelling, but also slower wound healing, increased bruising, and weakened blood vessel walls. In severe cases, deficiency can lead to scurvy, though this is rare in developed countries. If you notice sudden swelling in just one leg, or swelling accompanied by chest pain, shortness of breath, or skin changes such as redness, warmth, or open sores, seek medical attention immediately. While these vitamins may help support the management of mild, chronic swelling, they are not a replacement for proper medical evaluation or treatment of underlying health conditions. Let's wrap up with the key takeaways that can transform your leg health. We've covered 3 essential vitamins that work together to reduce swelling and improve circulation. Vitamin D helps your blood vessels function properly and reduces inflammation. Vitamin B1 supports heart function and efficient circulation. And vitamin C strengthens your blood vessels and fights the inflammation that contributes to fluid retention. Remember, these aren't just supplements. They're the building blocks your body needs to maintain healthy circulation as you age. The beautiful thing is that addressing these deficiencies often leads to improvements that go far beyond just reducing leg swelling. You may find that you have more energy, sleep better, and feel more comfortable throughout your day. This video is intended for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you experience any symptoms, discomfort, or health concerns, please consult your doctor or a qualified healthcare provider. Always consult your doctor before making any changes to your diet, supplements, or lifestyle. If you found this video helpful, please take a moment to subscribe to our channel and give this video a like. Until next time, keep taking care of yourself and remember that small changes can lead to big improvements in how you feel.